Some conversations you know are going to be special before they even really get started, and this was absolutely one of them. Today's guest is Phyllis Barkman Ferrell, a life science executive with a doctorate in global public health leadership and an MBA from Stanford, who spent nearly 30 years at Eli Lilly, including leading their global Alzheimer's disease development team and serving as global head of external engagement for Alzheimer's and neurodegeneration. What makes Phyllis's story so remarkable is that her work was never just professional. In 2011, 6 months after taking on the Alzheimer's portfolio at Lilly, her father was diagnosed with the disease, turning what was already a mission into something deeply personal, something I can certainly relate to. She's also the visionary and founder of the Davos Alzheimer's Collaborative's Health System Preparedness Program and serves on numerous boards advancing early detection and brain health globally. I have to say, this was one of the most enjoyable, warm, and candid conversations I've had on the Reaching Higher podcast. Phyllis came ready to laugh, ready to go deep, and ready to challenge all of us to think differently about Alzheimer's. I think you're going to love her as much as I do. And as always, this is Aaron Strout, host of the Reaching Higher podcast. Phyllis, welcome. I know I'm already going to love this conversation because you and I have already talked about things like why people stay at Eli Lilly for 30 plus years. We've talked about Zoom mullets, or I guess in this case, Riverside mullets. And so this is going to be fun. And we'll give a shout out to our friend Nurse Rosa, who is how I met you. But welcome to the show. I'm really excited to talk to you today.
Thank you for having me, Aaron. I'm excited too. This is going to be fun.
It is going to be fun. And you can usually, like I said, you can tell pretty quickly whether it's going to be a dry conversation or not. I know this is not going to be dry. One of the things I do always like to do is I like to get into the why behind, sort of how people got to where they are. Some of them are more straightforward, some are not. And so I think you and I, in talking in our prep, decided we're going to combine two questions. But the first is, you've said, and I hate this answer, and people will find out why in a second. You're passionate about Alzheimer's advocacy and brain health so that other boys don't have to grow up without their grandfather's presence as your sons did. So broke my heart a little bit when I sort of was reading about that. Tell us more about that story and how it became the fuel for everything you built in the space. And then we'll transition a little bit to the 2011 turning point at Lilly.
Yeah. Well, I have been at Lilly for a long time. I took early retirement 2.5 years ago. I'd been there almost 30 years. The first half of my career was a very traditional commercial career. And about 2011, Lilly asked for me to take over responsibility for their late-stage Alzheimer's disease drug and diagnostic development team. So I moved over to do that. Hadn't had any experience with Alzheimer's disease, had worked in quite a bit in neuroscience and some women's health. Was really excited to do it. And 6 months after I took that job, my dad was diagnosed with Alzheimer's disease. And so if you don't believe in some sort of invisible hand at work, I spent the rest of my career at Lilly really fighting both a personal and professional journey. And it was through that experience, being a loved one and a family living with this disease, at the same time we were trying to discover new drugs and therapies for the first time in 30 years, that I realized how hard the process was. And I threw myself into it, every bit of me. It wasn't just a job. It wasn't, I'm going to do this role for a little bit and then rotate to something else at Lilly. Once I was in, I was in. And that was where I really learned how this disease impacted families and economies and everything else you want to talk about today too, Aaron. But my father was diagnosed with Alzheimer's disease, although I don't actually think he had it, which we can talk about 6 months after I took that job. And then 18 months later, my father-in-law was. So although Alzheimer's disease typically, affects women more than men, we had two men in our family, and these were two big, beautiful, full personality men that had been executives, government, both were veterans, and their boys didn't have them. at baseball games and basketball games. And the number of times I remember saying, God, my dad would have loved to have watched one of my sons play whatever sport they were playing at the time. And they missed out on all that. And so I just became very, very committed to the space. And I was so lucky that I worked for a company that had been doing research basically without ceasing at that point for 30 years. And I was able to jump in and help out.
Okay, where do we go from there? I'm a little choked up because I think I confided with you. So Alzheimer's slash dementia has impacted my family as well, and it impacted my dad and took him way too young, as well as my grandmother. We had a good long life with my grandmother, amazing woman. But my dad, I was lucky that my two oldest kids, so I have a 27-year-old daughter and a 24-year-old son, and so they're the oldest grandchildren, and they get to spend a lot of time with my parents' early days. My youngest, who's just turning 19, feels a little bit robbed because not only did my dad die, I think it was about 5 years ago, he also had that decline, right, that you get with this, where they're not quite themselves and forget a lot and repeat themselves a lot and tell stories over and over again, which is heartbreaking. But where I feel the worst is my brother and sister have younger kids. My brothers are a little bit closer in age to mine, and then my sister has two younger boys, and they didn't ever really get to know their grandfather, and then my mother got taken early as well, which was heartbreaking. So I do want to go down a path in addition to saying, like, I'm so sorry, and that is really heartbreaking to me. We talked a little bit about the difference between Alzheimer's and dementia, and I think you had commented on the fact that I seem like I might be one of a few that actually knew that there was a difference.
Know the difference.
Could you give us the high level, knowing that there are a lot of people that have probably heard these two terms interchangeably, and since you've spent so much time in the space defining, and I know I didn't have this on your list of questions, but I'm sure you can answer this, like, unfortunately, it's your job. Tell us a little bit more about, what the differences are between the two.
Well, Aaron, I'm so sorry for your family experience as well. I wish I could tell you that we were the only two families who've dealt with these diseases. I often do these conversations and I ask people, raise your hand if you know someone with Alzheimer's dementia or someone who's caring for someone with Alzheimer's or dementia. And 85% of the hands in the room go up. This is not a disease that's an orphan disease. This is something we have to do something about. So getting our language right is one of the very first things we need to do. And I was so appreciative that you knew the difference between Alzheimer's and dementia. So we're really bad about this. We're sloppy with our language, both in the lay community, but also in the medical community. And let me just give you a highlight of this. So dementia is the end of a syndrome of cognitive decline. So if you think of yourself on a scale, a cognitive scale from cognitively normal to mild cognitive impairment to mild dementia, moderate dementia, and then severe dementia. Those are a set of clinical symptoms that really have to do with your cognitive ability and when that cognitive decline starts shifting into functional ability. So things like balancing your checkbook or being able to drive, or I always use the example of getting Thanksgiving dinner all out warm at the same time, which takes a lot of organization, right? And so, which by the way, I'm not sure I could do today, but that's another story.
I was going to say, even for the best of us, that one might be tricky. But
So that's your cognitive status, right? And Alzheimer's is one cause of cognitive impairment dementia. It happens to be one of the largest causes of cognitive impairment and ultimately dementia, but it's used as kind of a shorthand. Right now, we used to say we thought it was about 70% of the population. It's probably closer to 50 to 60%, as we're learning now that we have more representative samples in our clinical trials. But basically, Alzheimer's disease is hallmarked by the pathologies of amyloid and tau. And so amyloid is this sticky plaque that actually literally sticks to the brain and causes neuronal dysfunction and synaptic demise. Tau tangles are intracellular, so that happens inside the cell. So one's extracellular, one's intracellular. These are the hallmark pathologies of the disease. And it's one of the reasons why we've had such rough time of studying drugs, because for a very long time, we actually couldn't see the pathologies in a living brain. The only way we could actually really diagnose Alzheimer's disease was on a microscope slide, and there weren't a lot of living people who volunteered for brain biopsy.
Right.
So it wasn't until the advent of these PET scans that allow you to inject a ligand into the bloodstream. It goes up to the brain, it binds to the plaque, and then you do a PET scan and it lights up on the scan. And we could finally see this amyloid plaque in the brain. And now we can see the tau as well. But at the time, this was transformational. And when I tell you, it's only been really within the last 10 years. We all of a sudden realized that the amyloid plaque was building up in the brain 10 to 20 years before symptoms. So as a result, we've been really treating this disease. If you wait till dementia, that's like treating cancer at stage 4. Who wants to catch their cancer at stage 4 when you could have gotten it at stage 1?
Right.
And so this advent of this technology as PET scans really transformed the field, what we knew about the disease. And then, of course, now we have blood tests that it's exciting that we're able to potentially see this pathology in the blood as well. But that's the real change that you're seeing now. And that's the real difference between dementia and dementia caused by Alzheimer's, because you can actually have Alzheimer's pathology before you have any symptoms. And that's what we really want to do, is catch it then.
Right, because that is the thing where if you can get these, I like your analogy to the stage 4 versus stage 1. So anyone that doesn't know, stage 4 is really bad. Usually you do not survive stage 4. Stage 1, you have a much better, depending on the actual form of cancer, you have a much better chance of doing something about it. And I do appreciate like this early intervention. And it does seem like I know you said the last 10 years, it feels almost like just even the last 2 to 3 years, we've started to really have some of these breakthroughs that are making a difference. And so it is great that we're starting to find out more, almost like deep sea exploration. It's like the entire planet is covered with water, yet we haven't really spent the time. And now we're spending the time on this thing that affects at least 50% of the population, as you said. I do want to get into something, and you touched on this. You made a pivot from pharma to purpose, and one would argue you were doing both while you were at Eli Lilly. I've worked with a lot of life science companies, so I am not in the camp of bashing, pharma or life science, because there may be bad actors, there are a lot of good actors, and there are people like you that are doing good. So after 3 decades as a life science executive at Eli Lilly, you stepped away from the pharma world to take on an entirely new kind of role. So what has the transition been like, and how did you figure out what that reaching higher looked like for this next chapter?
Thank you, Aaron, for recognizing how many people in pharma really are doing it because they want to be part of a patient having a better life. So I appreciate you saying that. I think for me, what happened, I had just come over to the medical role and I had a commercial background, and I had someone come running up to me and say, Phyllis, we did it. We enrolled a clinical trial faster than anyone has ever enrolled an Alzheimer's trial. And I was like, that's great. Tell me more. They're like, it only took us 18 months to find 1,000 people in the US. And I went, huh? Like, wait a minute, time out. Why did it take us 18 months to find 1,000 people with Alzheimer's disease? There's 5 million people with this disease. At that time, we didn't even really need amyloid pathology. We weren't running amyloid inclusion, which was a mistake and has since been changed. But, we were looking for people with mild cognitive impairment and mild Alzheimer's disease and moderate disease. And there weren't a bunch of competitive studies. And I said, what is going on? And of course, I had a commercial background. And so I started doing...
Can you just, because you've used commercial a couple of times, I know what commercial means. I think if people outside of the industry don't, tell us a little bit more about what that type of role is versus like a research, bench slide type role.
So my background had been in sales and marketing. At the time, my highest degree was an MBA. And so I came from the business side of pharma. So I had spent time thinking about marketing and selling and how to make sure that people who could use and benefit from the therapies were actually able to get them. And so this whole idea of a research environment where we were celebrating finding such a very small fraction of the potential participants in a clinical trial didn't make sense to me. And what I did was I started kind of peeling back the layers of the onion there. And what I learned was only 50% of people with Alzheimer's disease ever get a diagnosis. Of those, that do get a diagnosis, 50% of them get in the very late stages. And only 30% of the people in the United States are told when the doctors make an Alzheimer's diagnosis for themselves.
That's crazy.
Can you imagine?
No.
I mean, this is where cancer was 30 years ago, right? Where we didn't use, say, the C word. Doctors felt like, well, there's nothing we can do. We don't want to do any harm. So they wouldn't even give them the diagnosis. So what was happening was we had this entire environment of people who might have wanted to participate in a clinical trial, who might have really felt empowered by doing that, wanting to make a difference, wanting to enroll, wanting to have the chance, to be part of the science. They were never even getting the option. And what I realized at that time, and I promise I'm going to get to the answer to your question about shifting to purpose. What I realized is we could be successful with this drug and no one will ever get it, because all of the ecosystem around the patient was broken. And so my goal at that point, when we realized that donanemab was going to make it, so that's the new Lilly drug, Kisunla, that's one of the first of the first two drugs approved in 35 years. When I realized it was going to make it, I had a choice to make at that point. Do I stay and try to launch a drug, which, by the way, I've launched multiple drugs being at Lilly. I've had that experience. Or do I break away and go try to fix the world so that the people around in that ecosystem, all the things that are making it more difficult for patients to get diagnosed, to get the care and treatment they need, whether it's one of the new therapies or something else, how do we fix that? So that was my pivot. And I got to do that in this really neat project, global health initiative called the Davos Alzheimer's Collaborative. But it's just been truly life-changing to get to have all that experience at Lilly and learn everything, and then be able to pivot and say, okay, now how are we going to make sure that people who can benefit from these therapies or can benefit from these diagnostics or these next sets of treatment that are coming, how do we make sure that happens? Because otherwise and today there's too many bottlenecks.
Well, thank you for doing what you do, because obviously I'm sure on the monetary side, it would have been more commercially beneficial for you to have stayed at Lilly.
We're not talking about GLP-1s.
No, we're not. No, but you are launching a drug. And so I like the idea that you took this path of, let me help change the system, which is broken. And I think it's something people still don't really realize just how bad it is. And we won't get into that or try to fix that today. But you did mention something, and this is something where I love the language. I use Claude as my generative AI partner to co-think through some of these questions. And one of the things that it teed up was this idea of the Davos Alzheimer's Collaborative. And it says in 2020, you're placed on loan to the World Economic Forum. This reminded me of soccer, right? Where, anyone that follows Premier Soccer, players can get put on loan to another team, which is a crazy concept. But you get placed on loan to the World Economic Forum, commissioned by the Davos Alzheimer's Collaborative, where you became the visionary and founder of the Healthcare System Preparedness Program. What does it actually take to build something that ambitious from scratch inside a global organization? Because I'm guessing, you have a lot of really smart people with a lot of ambition and a lot of opinions. And so to come in, and I know we'll get into doing it as a woman, which is probably doubly hard, right? For unfortunate reasons. But tell us a little bit about that experience and process.
Aaron, it was so fun because I actually didn't have this great big team. So Lilly saw the problem. We'd worked on it for a while, that this ecosystem was broken. I realized that brain health was not on the public health agenda, and I decided during COVID to go back and get a doctoral degree in public health. So I got a Dr. PH during COVID. And while we were doing that, I came across Gavi and CEPI, which are these two very large global health initiatives that were started by the World Economic Forum. Some people might have heard of Gavi and COVAX during COVID. And they're basically focused on immunizations and communicable disease, but they were commissioned by the World Economic Forum. And the reason they were commissioned by the World Economic Forum is that was the one place where the private sector and the public sector could commingle funds. So we worked with the World Economic Forum, and they commissioned the Davos Alzheimer's Collaborative. And Lilly was very generous because they seed funded the initiative and basically gave the World Economic Forum me. And so I get to go on loan or on secondment, if you use the European language, and basically with a blank sheet of paper, figured out how are we going to create this new organization that's really going to be focused on health system change. And, I graduated from Stanford. I had a lot of friends that went to be entrepreneurs. I went to this big corporate environment. I never really got that entrepreneur experience. And here I was with the best of both worlds because Lilly was paying my salary. And yet there I was with a blank piece of paper. And I remember when we announced it, I was like, we need to write a press release. And I kind of looked around me and I looked behind. I was like, I guess I'm going to write a press release. I didn't have a communications staff. And so we really grew this idea from using implementation science, which is a fairly new discipline, of how we were going to work together across multiple stakeholders to fix the problem. Today, in any therapeutic area, it takes between 15 and 17 years for a new innovation to become standard of care. So let me pause and say that again. In any therapeutic area, it takes 15 to 17 years for a new innovation to become standard of care. That's crazy town. And when you're talking about a disease like Alzheimer's, where you have a progressive neuropathological disease, ain't nobody got 15 to 17 years to wait.
No.
So our goal was to figure out what are all the barriers? What are the bottlenecks? What are the things that are going to be a problem for everyone in this space, but mostly for patients in their journey? And how do we knock down those problems together as a field in an open access, pre-competitive way? And I'm proud to say that we are now in 80 sites in 19 countries, half of those here in the United States. And we have an entire family of what we call our DAC SP family, our DAC system preparedness family of providers and health administrators and policymakers around the world that are all trying to work together to bring down some of these barriers that just make it too slow for patients to have access to either diagnostic innovation or care and therapeutics innovation.
Well, I think this is when you hear stories like this that it does give you hope that, it's the world is not all about sort of inertia and, people digging in their heels and slowing things down. God knows that there are still plenty of barriers, but it is nice to know that there are smart people that think about these things and put other smart people like you in a position to truly make a difference. So thank you. I'm going to say thank you a lot today for all that you're doing. I do want to bring up something. It's called the Alzheimer's Moonshot. And so this was launched in partnership with the Alzheimer's Drug Discovery Foundation and the Gates Venture. So it aims to break down silos and foster meaningful collaboration between mission-aligned founders, funders, and partners. So what does the collaboration actually mean in practice when stakes are this high and egos are this big? Because obviously you have some pretty big players in that space.
Yeah, they're very generous players, though. So Startup Health is an organization that is an accelerator for startup companies. They started largely in digital health, but now they handle all sorts of healthcare startup companies. And when I say accelerator, what I mean is they provide the coaching and the training for CEOs and lead teams as they go through what is a really tough process of fundraising, getting a company off the ground, go to market, contracting, et cetera. And they believe, and they talked me into it, that if they focused a moonshot around a single therapeutic area, we could actually create more value. So we launched the Alzheimer's Moonshot with the backing of our first two champions, the ADDF and Gates Ventures. And it's just been tremendous. I think we have 50 companies in there now. And these are startups that are working on everything from blood tests to EEGs that can be done at home, to enabling technologies for research, to TV that can be used to help care for a patient who's in cognitive impairment in some of the earlier phases of dementia at home. And so it's all of the above. And these companies, they get together and they share what they're doing. They talk about some of the challenges they're facing. They take care of each other, but they also look for opportunities together, and it creates a lot of organic growth. And they named it a moonshot because it's so similar in mindset to what put us on the moon originally, where you had 900 companies that all had their piece of solving the problem. And in this case, these are a group of companies that all have a piece of solving the problem. And what we know is one drug is not going to be the silver bullet. We know that one therapy isn't going to be the thing that fixes Alzheimer's disease. We know it has to be a whole ecosystem of innovation. And what we believe at Startup Health and as part of the Alzheimer's Moonshot is we need to have a very vibrant ecosystem for entrepreneurs. And that includes a funding ecosystem, and that includes a founder ecosystem where people want to bring their ideas and say, let's work together to solve a problem that's much bigger than any one of us alone.
Well, it sounds like an ambitious but amazing project. And speaking of, there's something else that you're involved in. You're a founding member of a group called Women Against Alzheimer's, and you've co-chaired a women's leadership council alongside with your global work. So how is being a woman, because we alluded to this, or I alluded to this before, how has being a woman shaped your approach to leadership in an industry that has historically been male-dominated at the top?
Yeah, life sciences was male dominated at the top. That's changing a little bit. There's some dynamics that are specific to the life sciences industry that drives that. But I would say, as a female leader, and I hate to be fully on gender stereotypes here because I can find male leaders that lead this way as well.
That's fair.
But one of the things that I can say as I work in this pre-competitive space is there's a lot of women. When we host our communities of practice for the Davos Alzheimer's Collaborative and we bring all the health systems together, a lot of times the health system leader that's coming in is a female. And I look around and I'm like, we have a much greater percentage of women in here than you would expect to find when you're talking about doctors and health systems and administrators and life sciences. And I have some hypotheses as to why that is. I think one is that women have this natural tendency to be collaborative and to find win-win solutions. We look at problems not necessarily as a zero-sum game, but instead, how do we develop a solution where everybody wins? We're less likely to worry about who gets credit for something. I think that helps a lot. And I think also these are implementation roles. So these are people who are going to roll up their sleeves and they're going to do this stuff that's not sexy. I mean, when I'm talking about implementation, the kinds of challenges that we're working through are not necessarily things that are going to get published on the cover of the New England Journal of Medicine, right? These are things that are basic blocking and tackling. And, I call it death by 1,000 paper cuts, when you've got to figure out, how do I make a scheduler for the physician to be a 20-minute scheduler instead of a 12-minute scheduler? Like, these are not sexy things, but they are the things that provide barriers to a patient having a smooth journey. And so I think there's some things about that are female. However, I'll say the executive director of the Davos Alzheimer's Collaborative is male. And we have lots of male partners there. I think the other thing that is different for women, and this is important as it relates to Alzheimer's disease, women are more likely to have Alzheimer's disease. And everyone used to think that was just because we lived longer. Well, we're starting to realize that's not the only reason. And we've got a lot more research to understand why it's different for women than it is for men. But the other thing that's important is caregivers are 4 to 1 more times more likely to be a woman, a daughter, a granddaughter, a niece, a daughter-in-law, and paid caregivers. So when you think of like CNAs who are angels on earth, most of them tend to be women. So I think the other thing that happens with Alzheimer's disease and with the work that I end up spending most of my time doing is you have people that are really passionate about this disease because they see it coming at them. But I'd be remiss to say that it's just a girl thing, because there's a whole lot of men who want to solve the problem as well, and we all need to solve it.
We do, and so I appreciate your candid response there, and certainly never trying to pigeonhole, but I think you said some things in terms of like the collaborative willingness to give to share credit. And then just, to your point, a lot of the caregivers are female naturally. So I really appreciate that answer. I do want to get into something.
Aaron, I was talking to a founder. I'm sorry, I interrupt. And
No,
I'm going to
please do.
steal her anecdote because I was talking to a founder yesterday, and we were just on the phone, and she said, I don't know. I feel like I'm going into the wilderness with a machete and chopping down the path in front of me. And she said, I don't know if I'm going to be successful to getting on the other side, but I sure hope that I've created a path so that the woman behind me, when she picks up her machete, can keep going from where I've been. And it was just it's such a visual of the way we think about this work that I loved it is, we're out there kind of hacking away at trying to find the path. And if at some point we get tired, there's someone coming behind us that we're going to give that machete to, and they can take that next leg, or, the baton, if you're thinking as a runner. And I do think that you've got to have that mindset to do this kind of work.
Well, that may be the title of this, because I love that idea of, mutually, hacking with the machetes and getting through it all, and also doing it collaboratively. I do want to talk a little bit about brain health, because you sort of touched on this a little bit with, I think, television for people that are cognitively impaired. And I know we're, becoming much more aware of brain health. And again, back to Katie Couric, I know almost weekly she talks about things that are good for brain health. So many people conflate brain health, though, with Alzheimer's prevention, and the two are, I believe, mutually exclusive. They can benefit one another, but how do you define it? And what are the most important things that people should be doing right now that they're probably not? And a quick follow-on as you're answering that, I think many of us play these New York Times games like Wordle and Connections. Those are the ones that I do. Do those actually help? So I know that's a big question, but I'll let you jump in.
Yeah, well, it's a perfect one for this audience too, because I love telling people that we have agency with our brain health. There are things that we can do, and I think that's so empowering. So what I can tell you, and I'll stay to the science here. What I can tell you is that the Lancet Commission in September of 2024 came out with a meta-analysis of what we know about brain health and the things that we can do in order to make ourselves more resilient. This is based on some work by Mia Kivipelto at the Karolinska called the Finger Study, and has been replicated around the world, including here in the US with the Alzheimer's Association's Pointer Study. And basically, there are several things that we can and should be doing for our brain, and we should start doing them right now, Aaron. I don't mean wait until you're 65. I mean we start doing them right now. Now, to be clear, this Lancet Commission article said that we can prevent 42% of dementias with these changes. Now, those words are really, really important. Notice that I said dementias. I did not say Alzheimer's disease, because this is the work in the study was done in all-cause dementia. So it could include vascular dementias and other types of dementias. That's really important, because I'm not here to tell you that you can blueberry your way out of Alzheimer's disease. If amyloid pathology is there, it's likely you will need a drug. But there are things that you and I can do for our brains, just like we can for our bodies, to make sure that we're more resilient if disease comes for us. So those things are Mediterranean diet, regular exercise, quitting smoking. Nobody should be smoking anymore.
That's fair.
Alcohol in moderation, if at all. Tightly manage your blood pressure and any other cardiometabolic disease. That's really, really important. Social engagement, cognitive engagement, which is where your puzzles come from. And the most important one that executives miss, and especially female working moms, is sleep. 7 to 8 hours of sleep every night. That's when the glymphatic system, that's kind of your brain janitor, gets in and cleans out all the toxins and the gunk from the day. So you really need to have 7 to 8 hours of quality sleep a night. So to get to your question about the crossword puzzles, they're not going to prevent Alzheimer's disease. But staying cognitively engaged will help your brain be more resilient, no matter what kind of dementia comes for you. And honestly, it's same around your heart, and it's the same around mental health. So what does that mean? That's why you'll hear people say, learn a language, or or learn a new instrument. I don't know that you need to do that, but make sure that you have a reason to get up every day. You have something that you care about, that you're passionate about. That could be volunteering, that could be working at your church, that could be a whole lot of things, but something that's keeping you socially and cognitively engaged every single day. And we know that that has an impact. And now we have scientific data that shows that it does.
Yeah, I had a woman named Dr. Carrie Burnite, and she's a gerontologist, and she wrote a book that is very specific about that and talking about purpose among people in the older set and just how much that made a difference. And I think you also touched on it with your comment about socially engaged. So first of all, thank you. Very prescriptive. I'm good on probably 4 out of those 6, but I could do better. The alcohol one I am working on, I'm trying to be more moderate about that. But the pandemic taught us all poorly to, that when we're living at home and not needing to drive anywhere. Anyway, I digress. I want to get to some fun questions, and I know we've jumped around a little bit, so there's a couple that I skipped, but there is one that's a really important one that I didn't put in here that I do like to ask all the guests, and that is, you're part of a number of really important organizations and foundations. If people are to follow you, to donate, to give time, whatever it is that you'd like them to do, where would you like them to go? And if they're engaging with you personally, where would you like them to see your content or reach out?
The best place to find me is on LinkedIn. I do a little bit on X. Instagram, you're going to see pictures of my kids. But as it relates to brain health, LinkedIn is the best place to find me. In terms of how to give back, there are a lot of national organizations that are great. Us Against Alzheimer's is where the Women Against Alzheimer's started that you mentioned, and the Women's Leadership Council. That's a great organization. The Bright Focus Foundation is a wonderful organization that gives grants to young up-and-coming scientists for both brain and macular degeneration research. That's also wonderful. But I would say if this is something that you're really passionate about, go find either your local chapter of the Alzheimer's Association or your local Alzheimer's Resource Center. So depending on where you are in the country, those could be an Alzheimer's Association chapter. It could be a different type of chapter, but find those chapters because they're going to have wonderful opportunities for you. They're going to have obviously donation and funding. If treasure is your thing to give, they'll have that, but they also could so benefit from time. And, I've been amazed as a retiree now, I think, I can't be very much help. In a couple hours a week, I can add so much value to a small organization like that. And that could be board membership, that can be volunteering, that can be helping with fundraising, all sorts of things, strategy, financial planning. Are you an attorney? Can you give some of your time that way? And so if this is something that's passionate for you, a passion play for you, do it in your local community. You'll get much quicker gratification. If you want to write a check, I'm happy for you to DM me. I spend a lot of time with high net worth individuals who want to make a difference in this space. And just send me a DM on LinkedIn. I help them kind of figure out where they want to put their investment. There's so many opportunities to make this flywheel move faster than it is.
Well, that's a very holistic answer. Thank you for being so detailed, and we will put some of those links in the show notes. So we appreciate that. This is where I like to shift into some more lighthearted questions. Well, 3 lighthearted, 1 a little less lighthearted. But the first one is, and this is just so people can get to know you a little more personally. We started off personally talking about your journey with your sons. Show or podcast that you're binging right now, and I'm going to put it in Amy Poehler's words, like something that's making you laugh or giving you joy.
Oh, so I don't watch a lot of TV, but I do love a good podcast because I like to take a walk in the afternoon since I work from home. It's kind of my way. It's like my commute home where I can kind of decompress at the end of the day. Mm-hmm. And the podcast, it's kind of silly that I listen to, is called Criminalia. And it's actually 2 women, and they do these series on criminals. So one was like poisoners, and they go back and they're all these historical fiction and they're real stories, which is like one of the reasons I like them but they tell the story in kind of I guess they're not fiction, they're history, but they tell it in kind of a narrative. And then at the end of each one, I'm going to totally undo my brain health analogy here. They do a cocktail. that's named after the episode. And it's always some sort of fun cocktail that, needs like lavender or rose hips or something. And I never have those things, but I always think it's fun. And for me, they're right about the right amount of time. I like a podcast not to exceed about 40 to 45 minutes. It's about the time of my walk. And so I really like those Criminalia ones.
What a great answer. And I love the cocktail at the end, even though we're undoing our brain health. The next question I want to ask is, I'm guessing you had a chance to meet a lot of important people in your life through, all of the great roles you've held. Who has impressed you the most?
Oh, there's so many, but one that has been just kind of repeatedly impressive to me is a gentleman by the name of James Keach. Some of you may know him. He was an actor in like the Vacation movie, but he won an Oscar for Walk the Line. And I got to know him because he did the documentary on Glenn Campbell's life called I'll Be Me. If you haven't seen it, go watch it. It's on Netflix, I think. It's fantastic. It's Glenn Campbell's final tour, and it is the most, for someone who grew up with a dad and father-in-law that listened to Rhinestone Cowboy, I mean, it is just the most amazing story, and what his family, the courage that they showed to put out his last story, his last tour, and his fans, it was just amazing. And so James did that. I got to know him. He then did a movie about our team at Lilly, which did not get an Oscar and is not on Netflix, but you can find it on Amazon. But he has since basically transitioned his entire career from an Oscar-winning movie producer to doing stories now about health. And he's done one on ALS. He's did one on Linda Ronstadt. He's just done these amazing stories of making health attainable and real. And, I just think about someone like that who probably doesn't even have to work if he doesn't want to, or he could go work and do, these big fancy movies. And he's telling these really kind of just awe-inspiring stories. So James Keach, and go watch I'll Be Me if you haven't seen it yet.
Well, that's a good one. And I would say for those listening in, you'll definitely recognize him. He happened to have been married to Jane Seymour, who may have been even a little more famous than him. I just did a quick search. For 22 years, they get divorced, unfortunately, in 2015. And he does sound like a great potential future guest for the Reaching Higher podcast. So we're going to have to reach out to him.
He's remarried to a lovely woman who, her name is Nancy, and she actually is a leader in the Alzheimer's field as well. So I'm sure she's had quite a bit of influence in some of the decisions that he's made. But he is really a lovely man. They're a lovely couple, and I would highly recommend you watch his films. And yeah, Aaron, I'd be happy to introduce you to him.
Yeah, well, James and Nancy, we're coming for you next, and I may take you up on that offer.
That's right.
Two more questions. One is a little less fun and frivolous, but it is getting to the sort of honesty that I think people appreciate, and that is biggest regret in your life for all the great stuff that you've done.
I don't know that I would call it a regret, but I'm coming up on my 25th reunion with my Stanford Business School classmates. And one of the things we're all talking about as we're getting ready for our reunion is, what do we really want to focus on here in this next chapter? And I want to be more intentional with my friendships. I think one of the things that I let go, and look, I find a working mom or a working parent who doesn't do this, right? I had my kids to raise. I had a high-powered job, the demands of climbing the corporate ladder and all of those things. And as a result, I was not as intentional about my friendships as I wish I had been. And now I'm going to do that. I'm an empty nester. My youngest is off in college, and I'm going to make sure every time I have a business trip, I add a day on and I go see a friend that lives in that city, because I have friends all over the world. And so I just want to be more intentional. There's some recent work study that was just actually released by Harvard that shows that one of the keys to longevity is social relationships and the quality of those relationships. And so, like I said, I don't know if I would call it a regret, because I'm not sure how you create more time in your life. But I certainly want to make a change and a pivot now that I've got the capacity to do so, to really be more intentional in my friendships. And if I was talking to my 30-year-old self, this is what I would tell her, is be more intentional in those relationships. Don't just let them go and expect that you'll rejuvenate them later. You can, but you've missed out on a lot of time when that happens.
Well, it's really helpful advice. And I appreciate that while it may not be, I mean, I guess it is a regret because, you're doing something about it now, which is helpful.
Yeah.
And I know because I did just put out a book a couple months ago, one of the things I did as an exercise for it is I did write that letter to my 25, 30-year-old self. And one of the things I did say to myself was,
oh, that's cool.
Take better care of friends and family because, I also had a busy career and you have kids and you get caught up in things and you do tend to forget about those people that are meaningful and maybe they're not on social media or, don't sort of make it as easy to sort of hang out with. But none of us are going to die one day and say, oh man, I wish I had ignored, all these important people in my life.
Wish I'd spent more time at work.
Exactly. All right. Well, last question, and I'm always fascinated to hear how people answer this. So a band or an artist whose concert, ideally this band or artist is no longer around, the concert that you would have most liked to attended but can't. So like the Beatles are an obvious answer, Led Zeppelin are an obvious answer. Who meets that criteria
I'm going to
for you?
screw up this question too. If you haven't noticed yet, I'm not a big rule follower, but I get to tell you what I did last weekend.
Yes.
Earth, Wind, and Fire played at Cherokee Casino in North Carolina. And so for Mother's Day, I asked for tickets. And so my husband and I went down with my sister and brother-in-law and got to see Earth, Wind, and Fire in concert. And 3 of the originals were there. And it was really great. And part of the reason I wanted to do it is I don't know that I'd ever get to see them again. And the other reason is nobody can be unhappy when Let's Groove Tonight is on the music, so is playing.
Well, I love people that break the rules, so always encourage.
Okay, good.
B, you just endeared yourself to my wife, who is a huge Earth, Wind, and Fire fan. We did almost see them in Vegas a year ago. We were at the health conference, HLTH. We missed them by, I think, a day or two. It is like they are such a fun band, and anyone that has not listened to them, go to Spotify immediately and do start to listen. You probably have heard them, but they are a very fun band. But I'm going to thank you for all that you do, Phyllis. It's been such a pleasure to have you on. I knew from the second you came on that we were going to have a fun but serious and important time, and you checked all those boxes. And so I am grateful to now include you in my network and to have gotten to know you a little bit better and to share you with all my lovely listeners.
Thank you for having me, Aaron. It's been such a nice time, and I'm really glad that I got to be here with you.
Of course, and keep doing all the good work that you're doing.
You got it.